Running subcuticular suture. In this technique, both ends of a running suture are buried in the wound. The skin is approximated by snaking the suture at the epidermal-dermal junction. This is the surgeon's favorite for cosmetic wound closure and ideal for patients who might not follow up for suture removal. Let's proceed. To start the running subcuticular suture, you need first to anchor the suture with a single deep dermal stitch near the apex of the incision. Tie the free end of the suture with a surgeon's knot and square knot. Then, cut the free end short to be able to bury the knot. Next, load the needle backwards on the driver and place a stitch from the deep side to the superficial side of the apex of the wound. It should come out at or near the epidermal-dermal junction. Invert the skin edge with a forceps to show the junction. Then starting at the apex, have your wrist back and drive your needle in at the level of the epidermal-dermal junction. When you're doing this, simply turn your wrist to advance the needle and let the curve of the needle do the work for you. Reload the needle and take note of the next target at the opposite edge. It should always be directly across the exit point or 1 to 2 millimeters back. Now grasp the edge of the opposite side and invert. Insert the needle directly horizontal or 1 to 2 millimeters back to where you exited on the first side. Direct the needle point so that it exits at the epidermal-dermal junction. Now that you've learned this, simply repeat the technique as you alternately switch sides until you reach the other end of the incision. So again, some points to remember. Never start in front of where you exited from the first side because there will be a gap in your closure. Also, let the curve of the needle do the work for you every time you advance your driver by twisting your wrist. So we're almost done here. As you reach the end of your incision, let your final bite exit at the apex of the wound. But do not pull the suture all the way through. Release the needle from the driver and leave a loop to perform an Aberdeen or fisherman's knot. To do this, grasp the needle end of the suture taut with your non-dominant hand. Then with your dominant hand, place your fingers through the loop and grab the suture being held taut by the other hand and pull the strand without letting go with your other hand. As you do this, the loop will tighten and you will create a new loop within the strand that you are pulling. Do this maneuver one more time. In fact, you can do it as often as you want. Now to lock the suture, pull the entire suture along with the needle through the loop and then tighten. To tighten, you may use your instrument to push down on that suture as the loop closes. Then, reload your needle on the driver. And drive your needle into the wound and out to the apex. Take a nice wide bite of the suture, pass it out through the skin. Cut the suture flush with the skin surface to bury the knot. Easy peasy. Again, it's your turn.